I think definitely in the ICU where we get patients. I mean, our turnover rate is very quick. You know, we send patients out and then we get new ones, and definitely for admissions it is wonderful because a lot of the other hospitals are also connected. So if a patient has been to another hospital or is being transferred from another hospital, their records are already in there. You can look up their past medical history, you know, their allergies, you know, anything to sort of prepare for the patient getting here. And to, you know, the duration of their stay, like I can look up everything that happened with them yesterday or the day before that and things like that, where as opposed to when it was the paper chart, it was a little bit harder because there was a lot more you had to sort of flip through to find different things. I mean, the information was there, but it's much more organized, and you know, it's, you know, they organize it by date, so you can be able to figure out stuff like that a lot easier too. So. But this is something you have to document every hour in here for the type of restraint, and then every 2 hours and every 4 hours. Pretty much all of our vented patients have restraints. And that's something that is very important to be documented, and I know that people have, I've heard nurses complaining because it is kind of annoying that you have to do it every hour, and it's one of those things that you forget because you're not thinking about it. It's not a vital sign, it's not something that you're actively, you know, but we had to do the same thing on paper. You know, we were just checking things on paper. So
what about things that aren't so great? Maybe there aren't any, I don't know.
When the system goes down and you have to go back to paper, and it's sort of that learning curve
I
of.
neglected to ask that, but that was one of my questions.
It doesn't have. It hasn't really happened very often.
Pretty a good percentage of uptime, I guess.
And it will be slow at times.
Close to 100.
Well, I don't
know.
Yeah, I don't really know. Yeah. But I've only had to go down twice, and we've been doing it for like a year and a half. So, and when that happens, the amount of paper that has to be printed is ridiculous because you have to print all of their the medication record. You have to print basically everything, and then you have to get out the paper charts and start writing on that until it goes back up, and then you have to put in all the information that you put on the paper back into the computer. Excellent for new nurses because I started there, and when you're fresh out of school, you know the basics about medications, but that way it's a lot easier. They always had a little thing you could hit on to learn about the medication, and then I mean, I'm sure it happened, but you always knew you had the right patient, you always knew you had the right medication. I mean, errors do still happen, but you know, it definitely cuts it down, and it's a big sort of relief for new nurses who are sort of, you know, just kind of getting wet into everything. So the technology and the fast-pacedness, I just couldn't really work on it. I mean, here, you know, we have a lot of that, and it still was busier there, but that's why I like working in a big hospital.